Hello everyone and welcome to Mteto News Insights. I am Arlene Barbara. As a way of advancing the social protection agenda and spurring resonance across sectors and among its various actors, the Kenyan government, through the State Department for Social Protection, held a National Social Protection Conference 2018 in order to create an interactive community and platform for various stakeholders and actors to not only showcase their ideas, innovations, and best practices in the social protection arena, but also to exchange these ideas and learn from one another in the spirit of delivering the overall goal of social protection. The main objective of the conference was to scale up investment in social protection for the delivery of Kenya's Vision 2030 and achievement of SDGs.
It is clear that a poor person, one who cannot meet basic life requirement, is not a very confident person. But our long-term objective is to ensure that, as we caution, we address a situation where we know we do not only provide food as basic requirement, but we go further and ensure that we build capacities of this particular sector of the country, of the population, to be able and to manage their own affairs. I wish to reiterate that my ministry remains dedicated to moving forward the social protection agenda, including incorporating the deliberations that will come out of this conference into its evolving policies. I have no doubt that together we can invest more, implement and ensure full benefits to our people. We consider this very important occasion as a learning session where recommendations and views that will come up on the floor will be incorporated in our long-term strategy in addressing this so that we can do better than the way we are doing now.
Social protection has emerged as a very strong and effective tool for positively impacting on the lives of many families in Kenya, including orphans and vulnerable children.
Basically, at the different phases of the life cycle. So you can have child benefits for families with children. You can have old age pensions or old age benefits, disability grants for those who cannot work due to the severe disability, and also to support the families that are taking care of this family member that is severely disabled. So there's a variety of demographic patterns that are covered by social protection. And there is some suspicion that if the government provides cash to these families that are in need, that they are not going to provide their labor force in the labor market. So they are going to create the dependency. It's interesting to observe, for example, that there is less resistance to the idea of cash for the elderly, for example, because there is the idea that the elderly, they don't have the work capacity, so it would be okay to provide for them and to help the families that are taking care of them. For the disabled, it's similar. It's much more challenging to convince society at large that it's okay to support families with children. And why is it? Because in general, the families who have children are families that at least the parents, they are in the working age. So they could be working, or they could be providing the labor force in the market. So that's the biggest challenge.
We always say when you're working with children, protection starts with you, you know, and social protection, now if it starts with me and then you and then you, then all of us together, we are able to come up with social protection. So it's an all-round thing and should focus on all-round things. We've discussed on issues of education, nutrition, health issues, issues on being protected against violence. Those are very, very, very key issues that needs to be looked into. And the report that has been done by Save the Children and SPF. I think that is something that if run and implemented, it's going to really help in combating issues of violence and just bringing up the social protection issues within the community, and working with all the stakeholders, basically from the politicians to the local people, the children themselves, who are the beneficiaries, and the communities themselves are beneficiaries.
A workshop convened by East African Center for Human Rights brought together different civil society organizations to deliberate on how different countries at national level allocate funds to children issues during budget making process, because the well-being of children depends on how the national government through the national budget allocates funds to cater for children needs. An independent budget tracking analysis of different budgets in different countries found out some gaps in allocation of funds. Public participation is low, as participants do not always understand the terms used in the making of the budget. In Kenya, the budget analysis had various limitations that never met standards required, like the health and education docket.
We had an opportunity to do an independent budget analysis for an organization called Each Right, and this was looking at the budgets of Kenya and Tanzania. And when we did this analysis, what we noticed was that progressively the two governments are increasing allocations towards the sectors of education, the sector of health, and social protection. But deeper analysis indicates that the percentages that are allocated, especially for education and health, are still below if you compare with the international standards that are required. For example, in health, the Kenyan budget had 3.7%, which is way below the Abuja declaration of 15%. And the education budget was at 10%. But when we looked at it deeply, we realized that a lot of this money is going into recurrent budget, paying salaries for teachers, paying salaries for tutors, and little is going towards infrastructure or initiatives that can improve the learning condition of children. And that is why you find that in Kenya we have so many private schools where people prefer to take their children. And also you can notice that there are so many private hospitals where people will prefer to seek medical health care, because allocations towards these sectors is minimal. And so the services that they receive in this institution is not good enough. So you'll find, like for children's services, there is very little that is allocated towards child protection and children's services.
There are so many things that we've been overlooking when it comes to budgeting, SASOs, I would say. Number one, we only want to know, okay, what allocation the government has given to certain sectors. For example, if it is health, we want to know how much has been out of the total budget, what has been given to health. But we never go to look deep and see, okay, out of the, per se, for example, if the government, out of the total budget, 20% has been given to health. How much out of the 20% has been allocated for the children? We never look at that. And when we see if they at all allocate children, what priorities are given in the allocation? Do they prioritize in medicine for the children, equipment for the children, or do they prioritize in buying equipment or furnitures for the officials? Or do they, when it comes to school, do they prioritize in buying more books, training teachers, recruiting teachers, or do they use that money to buy cars, vehicles for the officials, education officials? So
if organizations can come together and empower citizenry and also advocate for changes and formulation of policies that will strengthen institutions that are responsible for delivery of services. We found out in the two budgets that the absorption rate, especially for development project, was always below 30% of the allocated budgets. And this means that then if the absorption rate is low, then you have what you call allocation, you have an inefficiency in terms of utilization of the resources. So it's good to work with, to support government so that they are able to realize that they need to do more to to improve transparency.
Representatives from Uganda, Tanzania and Zambia also shared how their budgets in their countries work and how funds are used in allocated projects.
The budgeting in Zambia in relation to children, it's not very specific about children. I think the programs that are being put in place assume that children fall in the bracket of people. So the word people encompasses children. So what you notice is the state of budgeting doesn't necessarily pay particular attention to children, and you will not find specific programs designed to affect children. Even when you discuss issues like social grants, okay? There is what we call a social grant that is given to poor people. Children are not explicitly mentioned. So you notice that they are given a certain amount of money and the household is counted with a number of people there. So whether there are 4 or 5 children who go to school or not, they are given the same money as the family that has 1 child who doesn't go to school. So it's not very specific on children.
Ukiangalia status ya Tanzania katika budget kuna vipaumbele vya watoto au kuwapa vipaumbele watoto ni ndogo sana, kwa sababu kwanza haija indicate moja kwa moja kwamba budget gani inaenda kwa watoto. Tunaona tu kwamba tunaweza tukasema labda kwenye elimu, lakini pia labda kwenye afya, lakini haiendi moja kwa moja kusema kwamba 10% au 20 ni kwa ajili ya watoto. Kwa hiyo bado ni kitu ambacho tunakipigania sana kwamba ifike wakati bajeti iende direct kwa watoto. Lakini hata hii ambayo ipo basi ipewe kipaumbele kwenye vile sekta ambazo zinamgusa mtoto moja kwa moja.
Ministry of Gender, Labour and Social Development, under which children falls, adopted what we call the National Children's Strategy on Participation. But despite adopting that strategy, there is limited participation of children in the budgeting process. However, also what should be noted is that over years there has been increasing emphasis on mainly infrastructure development. And as a result of that, it has crippled investment, public investment in the social service sector like education, health, social development sectors, water and sanitation, which has affected access to services, especially for children.
Many governments are preferring to, like in the 2 countries, to allocate more funding towards defense and security. And of course, that's money that now goes into things that do not help realize children's rights. What we want to encourage civil society organizations to work in the sector of budget advocacy to progressively empower communities, empower citizens so that they can be able to influence budget when it is being prioritized at the different levels of budget cycle like formulation.
Social protection should be emphasized in every country so that we protect the vulnerable in society. Follow us on Instagram, Twitter, Facebook and YouTube at Mtoto News. I am Anlin Barbara. Have a blessed day.